Good morning, everyone. Good morning, good morning. Wow, what a group. Welcome to the first National Summit on ACEs, and welcome to Philadelphia. It is my great honor to kick off what promises to be an incredibly rich and productive 2 days together. I'm Martha Davis, the Executive Director of the Institute for Safe Families, and I want to welcome you on behalf of our co-host, the Robert Wood Johnson Foundation, and our ISF team. Sandy Dempsey, ISF's co-founder and senior advisor, and the board of directors of ISF, our national advisors, several of whom are with us today, and the staff, Carolyn Smith-Brown, your timekeeper, and Marcy Witherspoon. For over 20 years, ISF has been focused on family violence and child abuse prevention efforts. We're locally based with many important national partners. For us, this day has been waiting to happen since 1998, but we didn't know it then. In 1998, ISF staff was sitting in an auditorium with over 100 healthcare providers, and Dr. Sandy Bloom delivered a talk on trauma theory. And she would deliver this talk in advance of our domestic violence lectures. But on this day, she flashed up a pyramid. And at the bottom of the pyramid said adverse childhood experiences, and at the top was early death. And Sandy said to this audience, she said, "The most important public health study has just been published. And this is going to create a revolution in how we care for people who have experienced trauma and adversity." That was 15 years ago. Some revolutions are a long time coming. But we are here today to recognize, celebrate, and acknowledge that this ACEs revolution is in full bloom. No pun intended. Sandy Bloom. So our goal for the summit is to advance the national dialogue on ACEs, trauma, toxic stress, and resilience, and to focus on creating a shared vision, language, and plan of action. As Dr. Robert Anda has often said, what is predictable is preventable, and this is what we learned from the ACE study, that early exposure to adversity will predictably create problems, and so we're here together to create an even more unified voice for how to prevent the predictable, to move forward together to find what is next. So we hope that during the next 2 days you have a new thought, that you meet new thought partners, that you solve a problem, that you unstick a spot where you've been stuck, that you can nourish that deep well of commitment that brought you to this work in the first place, and that you find some ways to sustain yourself for the long haul. I feel sure you will be inspired. And speaking of that which inspires and sustains, I would like to express a deep, heartfelt thank you to all of our local and national partners. They're listed in your program. I also want to especially recognize and acknowledge Joe Pyle, who is the president of the Scattergood Foundation. It is because of this support that we are here, and all of us are deeply grateful. Lately, I have found this new burst of gratitude. 4 weeks ago, I was in Boston running the marathon. Uh-oh, I hope I can get through this without crying. And I was 25 and a half miles into the race when we were stopped. And since that initial moment of bewilderment and panic, and of course till the moment that I knew that my children and partner were okay, I have found myself stopped in my tracks with gratitude. Really for everything. But in the past 2 weeks, for gratitude, for this summit. Marian Wright Edelman said, "I am really grateful to have something about which I am passionate and that I think is profoundly important." And this time together is profoundly important. And we are so grateful for this opportunity to host it together, and we will take this revolution to the next level. And now I would like to introduce Jane Isaacs Lowe. She is the senior advisor to the Robert Wood Johnson Foundation, and her thinking and vision is a part of this entire summit.
Good morning. So it's really exciting to be here. I must say that when Martha and I started talking about this meeting about a year ago, our vision was tiny. It's still tiny, but it's gotten bigger in the last couple of months. And I recognize so many of you from across the country. It's really delighted to see funding partners and people that we've worked with at the foundation, and I'm certainly looking forward to getting to talk with many more of you. I was thinking hard about my remarks, and I decided that I wanted to tell you a story about a 10-year-old boy named Ronaldo. So I can still remember him meeting me at the door, frantic, saying, "Something is wrong with my mother." He pulled me into the bedroom, and blood covered the sheets, and his mother, Isabel, laid curled up, moaning in pain. In quick order, my emotions went from fear to panic to action. With no accessible phone, I told Ronaldo to get his mother dressed, and I ran to the corner to find a payphone. Out of order, I begged a man sitting in his gypsy cab to drive Ronaldo and his mother and me to the hospital. The ER was crowded. Isabel was sitting on a straight chair, bent over in pain. Her son was holding her hand and talking quietly in Spanish while looking at me with imploring eyes. We had been sitting there for nearly 2.5 hours. That was it. With all the courage I could muster, I went to the charge nurse and demanded that Isabel be seen now. It was the fall 1971. I was a first-year graduate student at Columbia School of Social Work in New York, doing my field placement in the Department of Public Welfare in the South Bronx. A recent college graduate, raised in the suburbs, I kept feeling as if this were a bad dream and I would wake up any moment. I wish this story had a happy ending, but it didn't. Ronaldo joined his 2 younger siblings in foster care. I saw Isabel every week in the hospital, and with my very limited Spanish and her limited English, we talked. Her biggest concern was always about her children. I tried without success to get the hospital to bend their policy of no visitors under 14. I headed home for the holidays and returned to the news that Isabel, age 33, had died on New Year's Day. The last time I saw Isabel, she gave me the keys to her apartment and told me if she died, I should go and collect things for her children. Now I had to do that. I gathered pictures, a locket, a basketball, and a few pieces of children's clothes. And several weeks later, I took those to the children in foster care. This experience, now some 40 years old, is seared in my soul. I decided at that point that I would devote my career to work where I could try to change environments, where people live, where people learn and play, and the systems that, in spite of all their well-intended missions, fail people. As a hospital social worker, as a faculty member, and now at the Robert Wood Johnson Foundation, I do what I do for all the Isabels and Ronaldos across the country. We can do better, and we must. I think about Ronaldo often. I think about the legacy of those traumatic experiences that he carried into his future. And I think about what it must have been like to grow up with hospitals and schools and child welfare agencies that didn't know how to recognize or address the burdens he carried. And I wonder how he has done. Of course, 1971 wasn't exactly the Stone Age, and we did have screening tools to assess risk and vulnerability. We had basic understanding that social factors profoundly influenced whether people were healthy. We had clinical protocols for psychological assessments and treatment, and significant knowledge of child development. We knew that positive, caring relationships were central to healthy development and that protecting children was important. But we were limited by our lack of data and by the fact that systems simply weren't built to coordinate and integrate care. We were limited by what we didn't know. And today, it is different. Thanks to decades of neuroscience research on brain development, to the ACEs study, to the work on toxic stress, we now understand how a child who is exposed to violence or neglect or chronic homelessness or living with a parent with mental illness at an early age may develop behavioral and physical health problems later in life. And we can now use this rapidly evolving knowledge to create real-world solutions and to improve the systems that are designed to help people in need. At the Robert Wood Johnson Foundation, my colleagues and I are exploring the connection between experiences of adversity in infancy, childhood, and adolescence, and the negative health effects that unfold across people's lifespan. And we're looking for the best ways to bridge the astounding discoveries emerging from neuroscience with the most rigorous health and social service interventions to change the physical, social, and mental health outcomes for vulnerable kids and their families. Because the sources of adverse childhood experiences are so varied and so embedded in communities and families, it will take a collective approach, one that works across different fields and sectors that often have not typically worked together to create change. Now it is our job to ensure that everywhere, parents and grandparents, doctors and nurses, teachers and principals, probation officers and judges, social workers and others can take this emerging knowledge and start to build the resilience of a new generation of children through more intelligent practices and policies. We have a wonderful and unprecedented opportunity over the next 2 days to learn together and explore how we can change the course of history. And I am confident that we will be able to do this. Thank you.